the problem with doing away with Obamacare immediately is that unless you have some plan in place to handle things like people who lose their health insurance because they change jobs, or they hit an income threshold because of Medicaid eligibility, that sort of thing, those sorts of transitions are going to have to be ready. And well, fortunately, our senior senator happens to have devised a plan that would take care of many of those things, and he introduced it here several years ago and talked about it at the John Locke Foundation.
And of course, you're talking about Senator Richard Burr, who was just reelected. So that'll be interesting to see what relationship develops between Senator Burr and the White House. One other thing that Senator Burr has been working on has to do with FDA drug approval. Tell us about that.
Well, from the time he was in Congress, then Representative Burr was very active in the FDA reform movement, and one thing that he was looking very closely at was the time it takes to approve new drugs that go through the pipeline, that there were a number of trials and testing and things like that that required drugs to be proven both safe and effective before people could use them. We've seen in some states enacting measures that are called the right to try, and that is, if a drug has gone through the process of approval and is safe, then people who are terminally ill could be allowed to use them even if they haven't necessarily been proved effective, because people who are probably going to die anyway, why shouldn't they have the opportunity to have some sort of treatment that might make reduce their pain or cause some reduction in suffering, or possibly even have some reversal of the symptoms that they undergo. Now, this is something that Senator Burr might consider working on at the federal level, because he certainly worked on improvements in health care for people, families who have children with autism and other sorts of disabilities and things like that. And this would be something that would be right up his alley, because he certainly has favored fast approval of drugs that are safe, and speeding up the Food and Drug Administration's process by doing things like allowing contractors to do some of the approvals rather than have the government do all of them, and measures like that, which at the margins can bring life-saving cures to market a lot faster.